October is the month when we focus on breast cancer awareness. And this morning, I'm pleased to have two doctors who are on the front lines in the fight against this disease 12 months a year. Dr. Melissa Joyner is the chair of the St. Joseph Medical Center Radiation Oncology Department. And Dr. Hayden is a board-certified radiologist. Also, they work hand in hand, the dream team, if you will. Thank you both for being here this morning. Before we talk more about breast cancer, you have an event coming up, Pink Power Luncheon coming up. This is your second year doing that. What do you hope to accomplish with that luncheon?
We are very hopeful that we're going to get a big turnout. We're going to reach out to women downtown in our local community to make them aware of their health care needs, breast cancer. This is Breast Cancer Awareness Month, and really hopefully open doors that people will have better access to care.
We always focus on this in October. You would think that everybody would know all they need to know, but you find maybe that's not the case.
Not always. Recently, there's been quite a bit of controversy, especially surrounding screening mammograms. So that's one of the things that we hope to get out at this Pink Power Luncheon, the importance of screening mammograms, how often to do them, when to start doing them. So that is one of the main things that we want to get out there.
With the spotlight on breast health and breast cancer awareness every year for this month, is there something this year that is new and more specific that women need to know about? You know, every year we want to find out something more we need to talk about.
I think technology is getting better. The way we approach women is getting better. I think our biggest challenge to date is actually just simply getting the word out to women. Women are scared a little bit, even though the Susan G. Komen Foundation does an incredible job of making women aware of the opportunity to get access to care. It's still hard to get that message out, and they're a little bit afraid to get a mammogram.
What do you think that is? Is it different communities view it differently, or what do you?
That's definitely part of it. We find a lot of times that African-American women or some minorities tend to get worse breast cancers because they don't get screened. So it is definitely, you know, has to do with which socioeconomic groups.
Right, lower income people clearly may fear the cost of coming in, the burden on their family. This is very true for Latina women. They are a big foundation of support in the family. And so to step out and admit that they may have an issue with their breast can be quite scary.
Well, you both are very passionate about what's going on. Dr. Hayden, I know one of the things that I was looking at that you were focusing on was the fact that at the age of 40, it seems like the incidence of breast cancer doubles from the previous group. That really got my eyes open on that one.
Yeah, which is why we recommend it at 40. The 40 to 50 age group has been quite the spotlight for the areas of controversy. A lot of people aren't recommending women 40 to 50 get mammograms. However, 1 in 6 breast cancers are diagnosed in women in their 40s. It's estimated that approximately 6,500 more women will die of breast cancer if the 40 to 50 age group is not screened.
And I've noticed as well through the years that the mammography is so much better now. You have 3D, all kinds. Talk about the level of specificity that the oncologists now have to work with that you didn't have before.
So one of the things, and I talk about this because we are the dynamic duo, we work together. So many levels of mammography take place. If a mass is identified, Dr. Hayden will do additional imaging. That information is then related to me. I look at the mammogram, I talk to the surgeon, talk to the medical oncologist, and we basically build a team approach to providing the best care for the patient. And then radiation can be a part of that care in the appropriate patient. And we know that if we get people in, we can actually cure the vast majority of people that we see with early detection.
So the challenge is there to make sure that women know about this and know that it's available to them. Once you find and detect, what is happening in terms of the ability to be able to cure now, in terms of the, you know, there's always an evolution in medicine.
Well, and you're right. There are better drugs. There are many drugs that you may have heard about. Herceptin is a big drug that has changed the face of breast cancer for HER2 positive. Not to get too technical, but this is a big change. Our radiation techniques are vastly different and better than 40 years ago. So I kind of tell patients sometimes, this isn't your mama's radiation anymore. And so less side effects. We have better ways to manage the drugs that the medical oncologists give.
Dr. Hayden, what would you tell that woman who's like a little bit nervous about coming in and seeing you, about being able to get that mammogram?
I would tell her that the prevalence of breast cancer is 1 in 8. So the chances are extremely high. The best chance for survival, however, is to get that mammogram. That's the best chances. Most of them are cured these days. I know women are scared. There's a lot of buzz about other things in the news, radiation and things like that, and none of that is relevant. What's relevant is that 1 in 8 will get it no matter what. And so the best chances for you to survive it is to have a mammogram and get it detected early.
Well, let's talk about the Pink Power. I want to put the information up. Pink Power Luncheon. It's Friday the 13th at St. Joseph Medical Center. $15. Is there still room? Is there still a seat?
There is. They're trying to make room for everyone that wants to come.
Gotta get some room. Get on in there. There's a number at 713-756-5051. But you can go to my webpage, my Newsmakers page on click2houston.com, and get that information as well. Thank you so much. I've heard you're the dynamic duo. Now I know it's absolutely true.
We are.
Dr. Joyner, Dr. Hayden, thank you for what you do.
Thank you
for what you're doing and giving women hope and help going forward.
Thank
Appreciate
you
very much. All right, just ahead. How's the baby?